Welcome to the NCLEX High Yield Test Series. In this session, we will go through 75 carefully selected, exam-level questions designed to strengthen your critical thinking and clinical judgment. Each question comes with clear, concise rationales to help you master high-yield topics across all NCLEX categories. We upload one full test series daily, so make sure to attend every video to stay consistent and sharpen your thinking ability. Let us dive in. Your NCLEX success starts here. Let us continue with critical NCLEX scenario that highlights the importance of monitoring circulation in a casted limb. The question number 1 is, what is the most appropriate nursing action to assess the neurovascular status of a client who has a leg cast extending from the ankle to the thigh? Here are the options. A. Check for a positive Hohmann's sign. B. Palpate the femoral artery. C. Compress and release the client's toenails. D. Ask the client to flex and extend the knee. The correct answer is option C, compress and release the client's toenails. Now here is why this action matters. When a client has a full leg cast, one of the most effective ways to assess distal circulation is by performing a capillary refill test. This is done by compressing and releasing the toenails to observe how quickly color returns, also called the Blanche test. A rapid return of pink color indicates adequate blood flow, while a delayed response could suggest compromised perfusion. This simple but powerful test gives direct insight into the client's neurovascular status, which is especially important when the limb is enclosed in a cast and at risk for swelling or compartment syndrome. Now let us move on to another essential NCLEX style question that highlights nursing care during radiation therapy. Question number 2. A client with breast cancer has completed post-lumpectomy chemotherapy and is now receiving outpatient radiation therapy. So, which nursing intervention is most appropriate during the course of this client's radiation treatment? Here are the options. A. Encourage the client to wear a snug-fitting bra between radiation sessions. B. Rinse the radiated area with an antibacterial solution after each treatment. C. Instruct the client to apply lotion twice daily to the skin on the radiated site. D. Assess the radiated area daily for redness or irritation. The correct answer is option D, assess the radiated area daily for redness or irritation. Now let us talk about why this is the best nursing action. Radiation therapy often leads to skin-related side effects, including redness, dryness, peeling, or even irritation at the treatment site. That is why it is essential for the nurse to perform daily assessments of the radiated area to monitor for early signs of skin damage. This allows for prompt intervention, such as applying appropriate topical agents or modifying care routines to prevent further complications. Regular monitoring is a proactive step in maintaining skin integrity and ensuring client comfort throughout the course of therapy. Let us now move on to an important clinical judgment scenario involving insulin management in a client with type 1 diabetes mellitus. Let's see question number 3. The nurse is caring for a client who is experiencing ineffective blood glucose control and upon assessment notices a sudden drop in blood glucose levels followed by rebound hyperglycemia. This pattern raises concern and prompts the question, what is the most appropriate nursing action in this situation? Let us review the options carefully. A. Encourage the client to eat smaller, more frequent meals. B. Give the client a glass of orange juice. C. Collaborate with the healthcare provider to alter the insulin prescription. D. Seek an order to increase the insulin dose at bedtime. That brings us to the correct choice. Option C. Collaborate with the healthcare provider to alter the insulin prescription. This is the most appropriate action because the client is likely experiencing the Somogyi effect, a phenomenon where an episode of undetected hypoglycemia, typically occurring at night, triggers a counter-regulatory hormone response that leads to rebound hyperglycemia in the morning. The correct nursing intervention is to consult with the provider to reduce or modify the nighttime insulin dose to prevent this cycle. In summary, recognizing patterns like the Somogyi effect and intervening by adjusting insulin regimens with the healthcare team is key to optimizing diabetes management and ensuring safe glycemic control. Now, let us shift our focus to a critical obstetric emergency. Severe preeclampsia. Question number 4. A client has been admitted to the hospital with this diagnosis, and the nurse must decide on the priority action to ensure the client's physical safety. So, what should come first in this high-risk situation? Let us evaluate the options. A. Reduce environmental stimulation. B. Initiate seizure precautions. C. Administer the prescribed sedative medication. D. Closely monitor intake and output. The most critical and appropriate response is option B. Initiate seizure precautions. This is the correct answer because clients with severe preeclampsia are at high risk of developing eclampsia, which is characterized by sudden, unpredictable seizures. To ensure safety, the nurse should promptly implement seizure precautions, such as padding side rails, keeping suction and oxygen equipment at the bedside, and ensuring emergency medications like magnesium sulfate are readily available. These interventions align with airway, breathing, and circulation priorities and focus on minimizing harm to both the mother and fetus. In high-risk maternal care, proactive seizure prevention is not just important, it is life-saving. Let us now move on to question 5, which focuses on dietary education for a client with type 2 diabetes mellitus. The nurse is assessing the client's understanding of nutrition, and one of the statements made suggests that additional teaching may be necessary. So, which response reveals a gap in the client's knowledge about managing diabetes through diet? Let us take a closer look at the options. A. I can eat as much dietetic fruit as I want. B. I need to reduce the amounts of saturated fats in my diet. C. I know that half of my diet should be carbohydrates. D. I can have a lettuce salad whenever I want it. The concerning response is option A. I can eat as much dietetic fruit as I want. This is the correct answer because it reflects a common misconception. While the term dietetic may imply a healthier or diabetic-friendly food, dietetic fruits often still contain sugar substitutes or natural sugars and contribute to the total carbohydrate count. Consuming them without limitation can lead to blood glucose spikes. Clients with diabetes must understand that all sources of carbohydrates, even those labeled as sugar-free or dietetic, must be tracked and portioned appropriately. This response clearly signals the need for additional dietary education to support optimal glycemic control. Let us now look at question 6, which focuses on environmental control measures for a child recently diagnosed with a dust allergy. In this scenario, the nurse is developing a teaching plan for the parents, and the goal is to identify the most helpful instruction to reduce the child's exposure to dust in the home. A. Housework must be done by professional house cleaners. B. Damp dusting the house will help limit dust particles in the air. C. The condition must be accepted because dust in a house cannot be limited. D. The house must be redecorated because the environment must be dust-free. The most practical and effective response is option B. Damp dusting. The house will help limit dust particles in the air. This is the correct answer because damp dusting is a widely recommended, evidence-based strategy to reduce dust exposure. Using a damp cloth traps dust rather than allowing it to become airborne, making it a simple and highly effective habit for allergy management. It is affordable, easy to incorporate into routine cleaning, and significantly beneficial in controlling symptoms in children with dust allergies. Now, moving on to question 7, we focus on a common and often under-recognized side effect of antipsychotic medications. A client who has recently started treatment with haloperidol is observed by the nurse to be pacing continuously and frequently shifting weight from one foot to the other. The key clinical question here is, what side effect is the nurse witnessing, and how should it be documented? Let us review each option carefully. A. Parkinsonism. B. Akathisia. C. Tardive dyskinesia. D. Acute dystonic reaction. The most accurate and relevant response is option B, akathisia, which is the correct answer. Akathisia is a common extrapyramidal side effect of antipsychotic medications like haloperidol, and it usually appears within the first few days of treatment. It is characterized by an intense inner restlessness and observable behaviors such as pacing, fidgeting, or an inability to sit still. Proper documentation and early identification of akathisia are essential because it often requires medical intervention, such as dose adjustment or the addition of medications like beta blockers or anticholinergics to manage symptoms. Recognizing akathisia promptly helps prevent patient distress and ensures safer continuation of therapy. Turning our attention to question 8, we confront a client on a psychiatric unit who continues to vocalize delusional thoughts after several weeks of hospitalization. The nurse's goal is to respond in a way that is both therapeutic and grounding. Let us consider each option in turn. Option A, ask the client to explain the delusion. B, allow the client to maintain the delusion. C, encourage the client to focus on reality issues. D, explain to the client why the thoughts are not true. The correct one is option C. Encourage the client to focus on reality issues. Let's see why. By gently redirecting the conversation toward concrete, present-moment topics, such as daily activities, upcoming therapies, or personal interests, the nurse provides a safe anchor in reality. This approach reduces the intensity of delusional thinking, fosters trust, and lays the groundwork for gradual reality orientation. Over time, consistent use of reality-based dialogue can diminish the grip of psychotic symptoms and support the client's progress. Let us now proceed to question 9, which focuses on emergency nursing care during a seizure. A client suddenly begins experiencing a tonic-clonic seizure, and the nurse must act immediately. In this critical moment, what is the nurse's priority intervention during the tonic-clonic phase? Let us analyze the options one by one. A. Go for additional help. B. Establish a patent airway. C. Turn the client on the side. D. Protect the client from injury. The most urgent and appropriate action in this situation is clearly option D. Protect the client from injury. This is the correct answer because during the tonic-clonic phase, the client is at high risk of injury from uncontrolled movements. The nurse should immediately clear the surrounding area of any objects that could cause harm, gently cushion the client's head, and avoid restraining them. These protective measures are essential to prevent trauma and ensure safety until the seizure resolves. After the seizure ends, the nurse can then position the client on their side, assess for airway patency, and document the event. This sequence of care follows established seizure precautions and prioritizes both physical safety and clinical accuracy. Next, let us explore question 10, which delves into the psychological underpinnings of anorexia nervosa in adolescents. A client has been admitted to the psychiatric unit with this diagnosis, and the nurse is assessing the core psychological reason behind the anorexic behavior. So, what is the primary internal gain that the client experiences through these eating patterns? Let us break down the options. A. Separation from parents secondary to hospitalization. B. Increased parental attentiveness related to massive weight loss. C. Release from school responsibilities because of illness. D. Reduction of anxiety through control over food. The most accurate and insightful choice is option D, reduction of anxiety through control over food, which is the correct answer. This response highlights the key psychological dynamic in anorexia nervosa. Clients often feel overwhelmed by emotional or environmental factors beyond their control. In response, they focus rigidly on controlling food intake and body weight as a way to reduce anxiety and gain a sense of personal mastery. This perceived control can temporarily soothe inner turmoil, but it reinforces a harmful cycle. Understanding this root issue helps the nurse approach the client with empathy, structure, and appropriate therapeutic interventions focused on restoring both physical and psychological health. Quick reminder, if you are serious about passing the NCLEX, do not miss our complete NCLEX course. Now at 70% off for a limited time, you will get live classes, 100 hours of animated crash course content, 500 hours of recorded lectures, 5,000 past NCLEX questions, 15 full-length mock tests, and in-depth breakdowns of 500 next-gen questions. Plus, it includes an exclusive NCLEX ebook, PDF notes, study planners, and 1-year full access. The link is in the description. Enroll today and take the next step toward becoming a licensed nurse. Let us now examine question 11, which focuses on the immediate care priorities for a newborn diagnosed with a myelomeningocele, a serious neural tube defect in which the spinal cord and meninges protrude through an opening in the spine. In this situation, the nurse must act quickly to protect the exposed spinal sac. So, which intervention is most appropriate right away? Let us walk through the options. A. Changing diapers immediately when moist. B. Placing the infant in the reverse Trendelenburg position. C. Applying sterile, moist, non-adherent dressings to the sac. D. Positioning the infant prone with the legs slightly adducted, the most immediate or direct action needed to protect the sac itself. That brings us to the best and most urgent intervention. Option C. Applying sterile, moist, non-adherent dressings to the sac. This is the correct answer because the primary goal at this point is to prevent the sac from drying out, becoming traumatized, or becoming infected. Using sterile saline-soaked dressings ensures that the exposed spinal tissue remains hydrated and intact while awaiting surgical intervention. This measure significantly reduces the risk of central nervous system infections, such as meningitis, which could be life-threatening in a newborn. Immediate protection of the sac with sterile technique is therefore the most critical nursing action in this delicate situation. Let us now explore question 12, which centers around managing discomfort and the urge to push in a client who is in active labor. The client is 8 centimeters dilated and begins to express significant pain along with a strong desire to push. She requests pain medication, but at this critical stage, the nurse must consider both safety and timing. So, what is the most appropriate response at this moment? Let us assess the options. A. Help her to take panting breaths. B. Prepare the birthing bed for the birth. C. Assist her out of bed to the bathroom. D. Administer the prescribed butorphanol. State all. The most therapeutic and appropriate response is option A. Help her to take panting breaths. This is the correct answer because the client is in the transition phase of labor, which is known for its intensity, rapid cervical changes, and frequent premature urges to push. Using panting or short, quick breaths helps the client resist the urge to push before full dilation is reached. Premature pushing can lead to cervical swelling, prolonged labor, or injury. In this situation, coaching the client through her breathing not only supports safe labor progression, but also offers immediate non-pharmacological pain relief. This intervention empowers the client, prevents complications, and upholds best practices for labor management. Let us now move to question 13, which highlights a routine yet life-saving intervention performed immediately after birth. A nurse administers an intramuscular injection of vitamin K to a newborn, and it is essential to understand the reasoning behind this critical step. So, what is the primary purpose of giving this injection so soon after delivery? Let us review the options closely. Option A maintains the intestinal flora count. B promotes proliferation of intestinal flora. C stimulates vitamin K production in the baby. D provides protection until intestinal flora is established. The most accurate and clinically sound answer is option D, provides protection until intestinal flora is established. This is the correct response because newborns have an underdeveloped ability to produce vitamin K due to the absence of gut bacteria, which normally synthesize this essential vitamin. Without vitamin K, the newborn is at risk for hemorrhagic disease, a potentially fatal condition caused by impaired blood clotting. The intramuscular injection temporarily supplies enough vitamin K to activate clotting factors in the liver and protect the baby until the normal flora gradually develops through feeding and environmental exposure. This standard intervention is vital for early newborn safety and exemplifies evidence-based neonatal care. Let us now turn to question 14, which focuses on dietary management for a pediatric client diagnosed with acute post-streptococcal glomerulonephritis, or APSGN. In this case, the child is requesting a snack, and the nurse must select the most therapeutic food option that aligns with the client's renal condition. So, which snack would be safest and most appropriate? Let us examine each option carefully. A. Peanuts. B. Pretzels. C. Bananas. D. Applesauce. The most suitable option, option D. Applesauce. This is the correct answer, because applesauce is low in sodium and potassium, making it an excellent snack for a child with APSGN. It is also easy to digest, well-tolerated, and gentle on the kidneys. By selecting applesauce, the nurse is making a therapeutic dietary choice that supports kidney function and reduces the risk of complications like hypertension and electrolyte imbalance. Proper snack choices in renal conditions are not just nutritional. They are an important part of the overall treatment plan. Let us now focus on question 15, which highlights dietary counseling based on a client's presenting symptoms. The client reports nausea, shortness of breath, and persistent right upper quadrant abdominal pain that does not respond to antacids. And notably, the discomfort tends to worsen after eating fast food. Based on this clinical picture, which dietary recommendation would be most therapeutic? Let us review the options thoughtfully. Option A, low fat. B, low carbohydrate. C, soft textured and bland. D, high protein and kilocalories. The most appropriate and targeted advice is found in option A, low fat, which is the correct answer. This recommendation aligns with the suspected diagnosis of gallbladder disease, such as cholecystitis or cholelithiasis. In these conditions, fat intake stimulates the gallbladder to contract, and when inflammation or obstruction is present, this contraction can trigger significant pain, especially in the right upper quadrant. By reducing dietary fat, the nurse can help minimize gallbladder stimulation and reduce both pain and digestive symptoms. This intervention is not only practical, but also directly addresses the underlying pathophysiology, making it the safest and most effective choice for the client. Moving on to question 16, we explore an urgent scenario involving burn injuries and delayed care. A client has sustained deep, partial thickness burns while working on a boat and has come to a first aid station for advice. Although the nurse strongly encourages a full medical evaluation, the client declines further treatment. In this case, the nurse must emphasize warning signs that would warrant immediate medical attention if they develop later. So, which symptom should the nurse highlight as the most critical? Let us go through the options. Option A, blisters appear. B, urinary output decreases. C, edema and redness occur. D, low-grade fever develops. The most important and potentially life-threatening sign is found in option B, urinary output decreases, which is the correct answer. This symptom suggests that the client may be developing hypovolemia as a result of significant fluid shifts from the intravascular space into the interstitial tissue, a hallmark of burn shock. This systemic complication requires urgent medical intervention to prevent renal impairment and circulatory collapse. Even in the absence of other severe symptoms, decreased urine output is a red flag that the body is no longer compensating adequately, and delaying treatment could have fatal consequences. Educating clients on this critical warning sign ensures they understand when to override their initial reluctance and seek emergency care without hesitation. Let us now explore question 17, which centers on psychological defense mechanisms and the barriers they create in counseling. A client with a documented history of compulsive gambling and recent legal consequences for embezzlement is now mandated to attend therapy. During the intake interview, the client makes the statement, "I never would have done this if I'd been paid what I'm worth." This response gives the nurse or counselor important clues into the client's thought patterns. So, which psychological factor will most likely pose the greatest challenge to helping this client gain insight into their behavior? Let us examine the choices. Option A, feelings of boredom and emptiness. B, grandiosity related to personal abilities. C, projection of reasons for difficulties onto others. Anger toward those who are in authority positions. The most fitting and impactful response is option C, projection of reasons for difficulties onto others, which is the correct answer. Projection is a psychological defense mechanism in which individuals displace responsibility for their actions by blaming external factors. In this case, the client justifies the embezzlement by claiming unfair compensation, avoiding accountability for their own choices. This tendency to externalize blame creates a significant obstacle in therapy because it blocks self-reflection, prevents ownership of behavior, and delays progress in treatment. Helping the client recognize and gradually move beyond projection is essential for developing insight, fostering responsibility, and achieving meaningful behavioral change. Now let us turn our attention to question 18, which emphasizes the importance of infection prevention in postoperative care involving a urinary catheter. A client has a urinary retention catheter in place after surgery, and the nurse must carefully plan interventions to ensure the client's safety. The key concern here is preventing complications such as infection. So, which nursing action is most important to protect the client in this situation? Let us go through the options one by one. Option A, empty the drainage bag every 6 hours. B, maintain the tension on the tubing. C, keep the drainage system closed at all times. D, attach the drainage bag to the side rail of the bed. The most important safety measure is clearly option C, keep the drainage system closed at all times, which is the correct answer. This action helps preserve the sterility of the urinary tract and significantly reduces the risk of catheter-associated urinary tract infections, CAIs. Once the closed system is compromised, through disconnecting tubing, opening the drainage port unnecessarily, or breaking sterile barriers, bacteria can easily enter and colonize the urinary tract. Maintaining a closed, intact system is the gold standard in urinary catheter care, and a top priority for infection prevention and postoperative client safe. Let us now explore in question number 19 that often arises in neonatal care. The scenario reads, the parents of a newborn receiving phototherapy ask the nurse why their baby's eyes are covered with patches during the treatment. So, what is the most appropriate explanation the nurse should provide in this situation? Here are the options. Option 1, the patches help keep the infant's eyes closed. Option 2, they reduce stimulation from bright lights during therapy. Option 3, the patches protect the conjunctiva and retina from injury. Option 4, They help decrease rapid eye movements and infant anxiety. After carefully reviewing all the choices, the correct answer is option 3. The patches protect the conjunctiva and retina from injury. Now, let us understand why this option is the best choice. Phototherapy uses high-intensity light to help lower bilirubin levels in newborns, but this intense light can be harmful to the sensitive structures of the eye. If the eyes are not shielded, there is a risk of retinal damage and irritation of the conjunctiva, which could lead to long-term vision problems or discomfort. Therefore, eye patches are applied to act as protective barriers, shielding the baby's eyes from potential injury during the entire course of treatment. Now turning our attention to question 20, we examine a scenario involving post-operative monitoring following a kidney transplant. The nurse is caring for a client who has recently undergone this major surgical procedure, and now the focus shifts to determining whether the transplanted kidney is functioning properly. So, which test serves as the most important and reliable indicator of that kidney's performance? Let us consider the choices carefully. Option A, renal ultrasound. B, serum creatinine level. C, white blood cell count. D, 24-hour urinary output. The most clinically valuable and accurate test is option B, serum creatinine level, which is the correct answer. Creatinine is a byproduct of normal muscle metabolism and is excreted solely by the kidneys. A functioning transplanted kidney should begin to filter creatinine efficiently soon after surgery, leading to a decrease or normalization of serum creatinine levels. This lab value is monitored frequently because it offers real-time insight into how well the kidney is clearing waste and maintaining homeostasis. Any unexpected rise could be an early warning sign of rejection, ischemia, or graft failure, making it a critical parameter in post-transplant care. Quick reminder, if you are serious about passing the NCLEX, do not miss our complete NCLEX course. Now at 70% off for a limited time, you will get live classes, 100 hours of animated crash course content, 500 hours of recorded lectures, 5,000 past NCLEX questions, 15 full-length mock tests, and in-depth breakdowns of 500 next-gen questions. Plus, it includes an exclusive NCLEX ebook, PDF notes, study planners, and 1-year full access. The link is in the description. Enroll today and take the next step toward becoming a licensed nurse. Let us now move on to question 21, which focuses on prenatal nutrition, particularly in the context of adolescent pregnancy. A pregnant teenager, currently 10 weeks into her gestation, presents for her very first prenatal appointment. During the nutritional assessment, the nurse learns that her usual intake consists mostly of soft drinks, candy, French fries, and potato chips. The nurse must determine why this type of diet is inadequate during pregnancy. So, let us evaluate each of the given options to understand the underlying concern. Option A, caloric content will result in too great a weight gain. B, ingredients in soft drinks and candy can be teratogenic in early pregnancy. C, salt in this diet will contribute to the development of gestational hypertension. D, nutritional composition of the diet places her at risk for a low birth weight infant. The most accurate and concerning answer is option D, nutritional composition of the diet places her at risk for a low birth weight infant, which is the correct choice. This diet lacks essential nutrients like folic acid, iron, protein, and calcium, all of which are vital for healthy fetal development. Adolescents, in particular, have increased nutritional needs because they are still growing themselves, and when they become pregnant, the demand for nutrients becomes even greater. A diet composed mainly of empty calories and processed foods may contribute to intrauterine growth restriction, increasing the likelihood of delivering a low birth weight infant. Early nutritional intervention is key to supporting both maternal health and fetal growth during this critical developmental window. Let us have a look on question number 22, which focuses on nutritional education for a child recently diagnosed with cystic fibrosis. The nurse is reviewing important dietary guidelines with the parents, and the question asks, which parental statement indicates correct understanding of the nurse's teaching? The options presented are option A, I will restrict fluids during mealtimes. Option B, I will discontinue the use of salt when cooking. Option C, I should provide high-calorie foods between meals. And option D, I should eliminate whole milk products from the diet. Now let us highlight the correct choice. The right answer is option C, I should provide high-calorie foods between meals. This is the best response because children with cystic fibrosis often experience malabsorption due to pancreatic enzyme insufficiency, which results in the loss of vital nutrients and calories. To compensate for this, their caloric requirements are typically 150 to 200% higher than those of other children of the same age and size. Offering high-calorie, high-protein snacks between meals is an effective strategy to help meet these elevated energy demands and support optimal growth and weight gain. This parental response reflects a proper understanding of the nutritional support needed in cystic fibrosis management. Next, let us move on to question number 23, which centers around client education for a patient recently diagnosed with glaucoma. The nurse is explaining the importance of initiating and maintaining treatment, and the question asks, which rationale should the nurse emphasize when discussing the significance of managing this condition? The options are: Option A, total blindness is inevitable. Option B, lost vision cannot be restored. Option C, use of both eyes usually is restricted. And Option D, surgery will help the problem only temporarily. The most appropriate and clinically accurate response is Option B, lost vision cannot be restored. This is the correct answer because glaucoma causes a gradual increase in intraocular pressure that leads to progressive damage of the optic nerve. Unfortunately, once vision is lost due to this damage, it is permanent and cannot be recovered. This reality underscores the need for early detection, prompt treatment, and strict adherence to prescribed medications or interventions. Highlighting the irreversible nature of vision loss helps the patient understand why consistent treatment is so vital in preserving whatever vision remains. Now, let us continue with the next important question. Let us now take a closer look at question number 24, which focuses on postoperative care for a client who has recently undergone a below-the-knee amputation. The nurse must educate the client on how to properly prepare the residual limb for future prosthesis fitting. The question asks, what should the nurse encourage the client to do in order to prepare the residual limb for fitting a prosthesis? The options provided are: Option A, abduct the residual limb when ambulating. Option B, dangle the residual limb off the bed frequently. Option C, soak the residual limb in warm water twice a day. And Option D, press the end of the residual limb against a pillow periodically. Among these choices, the most appropriate response is Option D. Press the end of the residual limb against a pillow periodically. This is the correct intervention because applying gentle pressure to the end of the residual limb on a soft surface like a pillow helps initiate the desensitization process and promotes gradual limb toughening. This prepares the site for weight-bearing and eventual prosthetic use. Over time, the client can progress to firmer surfaces as tolerated, which helps reduce sensitivity and improves comfort when the prosthesis is eventually applied. This early desensitization strategy is a key part of rehabilitation following an amputation. Continuing with question number 25, we now focus on acute care management for a client who has been admitted with an asthma exacerbation. The question asks, what should the nurse prioritize in the plan of care to best help this client? The options include Option A, determine the client's emotional state. Option B, give prescribed drugs to promote bronchiolar dilation. Option C, provide education about the impact of a family history. And Option D, encourage the client to use an incentive spirometer routinely. The most clinically urgent and appropriate response is Option B, give prescribed drugs to promote bronchiolar dilation. This answer is correct because during an asthma exacerbation, the client's airways become significantly narrowed due to bronchospasm, inflammation, and mucus buildup, all of which restrict airflow. Administering bronchodilators, such as short-acting beta agonists like albuterol, is the top priority to relax bronchial smooth muscle, reopen the airways, and improve oxygenation. This intervention rapidly alleviates respiratory distress and helps prevent progression to respiratory failure, making it the most immediate and life-saving action in the nursing plan of care. Let us now explore question number 26, which centers on evaluating the environment of a care unit for a client with dementia who is confused. The question asks, when assessing whether the unit promotes psychological safety for this client, which factor is most essential for the nurse to consider? The answer choices include Option A, needs are met entirely. Option B, nursing care is flexible. Option C, realistic limits and controls are set. And Option D, physical surroundings are clean and orderly. The most accurate and essential response is Option C, realistic limits and controls are set. This is the correct answer, because clients with dementia often struggle with disorientation, impaired judgment, and a lack of internal control. Establishing clear, realistic boundaries and maintaining consistent structure helps these individuals feel more secure in their environment. Predictable routines and external controls provide the psychological safety they need to reduce confusion and anxiety. This supportive structure promotes trust, reduces agitation, and enhances the overall quality of care for clients living with cognitive impairment. Now, turning to question number 27, we shift our focus to postoperative care in the post-anesthesia care unit, also known as the PACU. The nurse is monitoring a client who has just been extubated following surgery and is watching closely for any signs of acute respiratory distress. The question asks, which clinical finding should the nurse be most alert for as an early indicator of this complication? The answer options are option A, restlessness, option B, bradycardia, option C, constricted pupils, and option D, clubbing of the fingers. The most appropriate and critical finding to watch for is option A, restlessness. This is the correct choice because restlessness is one of the earliest signs of hypoxia, indicating that the brain may not be receiving adequate oxygen. This symptom can present as agitation, confusion, or irritability, especially in the immediate period after extubation. It is a red flag that the client may not be ventilating effectively and requires prompt assessment and possible intervention. Recognizing this subtle change in mental status early on can be life-saving, as it allows the nurse to act quickly and prevent further deterioration, such as full respiratory failure. Let us now examine question number 28, which presents an important scenario involving patient safety, professional responsibility, and ethical nursing practice. The nurse is caring for a client with severe preeclampsia who has been prescribed an intravenous infusion of magnesium sulfate. However, the prescribed dose is twice the usual adult dosage. When the nurse questions the order, the healthcare provider confirms it and instructs the nurse to proceed. The question then asks, what is the most appropriate nursing action? The options are option A, administer the dose and monitor the client. Option B, withhold the dose and notify the nurse manager. Option C, administer the dose and document it on the client's record. And option D, withhold the dose and notify the director of the obstetric department. The correct and most responsible response is option B, withhold the dose and notify the nurse manager. This is the right action because nurses have a professional, legal, and ethical duty to protect clients from harm. Administering a magnesium sulfate dose that is twice the standard amount poses serious risks, including respiratory depression, loss of deep tendon reflexes, hypotension, and even cardiac arrest. If the nurse believes the order is unsafe, it is not enough to rely solely on the provider's confirmation. Now arriving at question number 29, we focus on pediatric nursing care for a child diagnosed with acute post-streptococcal glomerulonephritis, also known as APSGN. The nurse is developing a plan of care, and the question asks, which nursing action is most appropriate to include? The options are option A, encouraging fluids, option B, monitoring for seizures, option C, measuring abdominal girth, and option D, checking for pupillary reactions. The best and most appropriate nursing intervention is option B, monitoring for seizures. This is the correct response because APSGN often leads to fluid retention, which can cause hypertension and sometimes cerebral edema. These complications may result in neurological changes, such as headache, altered mental status, or even seizures. Monitoring for signs of seizure activity and changes in neurological function is critical for early detection of complications and ensuring prompt treatment. This intervention directly supports the goal of preventing life-threatening consequences in children with this post-infectious renal condition. Let us now continue with question number 30, which addresses medication safety for an older adult client who regularly takes acetaminophen, also known by the brand name Tylenol, for chronic pain. The question asks, which substance is most important for the nurse to assess for because it significantly increases the risk of acetaminophen's most serious adverse effect? The answer options are option A, alcohol, option B, caffeine, option C, saw palmetto, and option D, St. John's wort. The correct and most critical response is option A, alcohol. This is the best choice because both alcohol and acetaminophen are metabolized in the liver and have the potential to be hepatotoxic. When used together, especially in high doses or over long durations, alcohol enhances the formation of toxic metabolites from acetaminophen, increasing the likelihood of liver damage or even acute hepatic failure. This risk is especially concerning in older adults, who may already have reduced liver function due to age-related physiological changes. Therefore, assessing for alcohol use is a key nursing priority when managing chronic acetaminophen therapy. Quick reminder, if you are serious about passing the NCLEX, do not miss our complete NCLEX course. Now at 70% off for a limited time, you will get live classes, 100 hours of animated crash course content, 500 hours of recorded lectures, 5,000 past NCLEX questions, 15 full-length mock tests, and in-depth breakdowns of 500 next-gen questions. Plus, it includes an exclusive NCLEX ebook, PDF notes, study planners, and 1-year full access. The link is in the description. Enroll today and take the next step toward becoming a licensed nurse. Let us now move on to question number 31, which addresses a deeply sensitive issue involving how to support a child when a sibling is dying. The scenario is as follows. The parents of a 7-year-old child ask the nurse whether they should tell their son that his sister is dying of cancer. This situation calls for both developmental understanding and emotional guidance. Let us review the options carefully. A. Your child cannot comprehend the real meaning of death, so it is best to wait until the last moment to tell him. B. Your son may fear separation most and needs reassurance that you will continue to care for him more than knowing about his sister. C. You should discuss this with your healthcare provider, who is more familiar with your daughter's prognosis. D. Although your son may not understand death as adults do, he still fears it. He should be told the truth so he can begin to prepare for the possibility of his sister's death. Among the options provided, the most appropriate response by the nurse is option D. Although your son may not understand death as adults do, he still fears it. He should be told the truth so he can begin to prepare for the possibility of his sister's death. Children around the age of 7 are in the early school-age developmental stage, where they may not fully understand the finality of death, but they are aware that something serious is happening and can experience significant anxiety, sadness, and confusion. Telling the truth in an age-appropriate and compassionate manner allows the child to begin emotionally processing what is happening and to feel supported and included. Let us move to question number 32, which focuses on recognizing the expected clinical findings in an adolescent girl diagnosed with anorexia nervosa. Select all that apply. Options. Here are the opinions. A. Fatigue. B. Pyrexia, fever. C. Tachycardia. D. Heat intolerance. E. Secondary amenorrhea. When assessing this underweight client, the nurse should anticipate signs such as fatigue and secondary amenorrhea, which are the correct answers. Fatigue occurs commonly due to severe caloric restriction, malnutrition, and low energy availability, often resulting in overall weakness and lethargy. Secondary amenorrhea, or the absence of menstruation after normal cycles have begun, is another key indicator, caused by disrupted hormonal regulation from extreme weight loss and nutritional deficiency. On the other hand, findings like pyrexia, tachycardia, and heat intolerance are not typical in anorexia nervosa. Instead, clients often display bradycardia and cold intolerance due to a slowed metabolic rate. Let us move into question number 33, which explores the nurse's initial therapeutic approach when caring for a client newly admitted with major depressive disorder. The question reads, a client diagnosed with major depressive disorder is admitted to the hospital. What is the most therapeutic initial nursing intervention? The options given are A. Introducing the client to one other client. B. Requiring participation in therapy sessions. C. Encouraging interaction with others in small groups. D. Conveying an attitude of concern that is not intrusive. The correct answer is option D. Conveying an attitude of concern that is not intrusive. This is the most therapeutic initial approach because clients with major depressive disorder often experience emotional withdrawal, hopelessness, and impaired energy. The nurse's priority during initial contact should be to establish emotional safety and begin building trust. By expressing genuine, non-intrusive concern, the nurse avoids overwhelming the client while still demonstrating supportive presence. This allows the client to open up gradually and sets the stage for deeper therapeutic communication later in the course of treatment. Now, let us move on to question number 34, which focuses on the complications commonly associated with chronic obstructive pulmonary disease. The question states, a nurse is assessing a client with a long-standing diagnosis of chronic obstructive pulmonary disease. Which complication is most commonly linked to this condition? The options are 1. Cardiac complications, 2. Joint inflammation, 3. Renal impairment, 4. Peripheral neuropathy. The correct answer is option 1, cardiac complications. This is because chronic obstructive pulmonary disease often leads to increased pressure in the pulmonary arteries, which places strain on the right side of the heart. Over time, this strain can result in right ventricular hypertrophy and eventually progress to right-sided heart failure, also known as cor pulmonale. Since the heart and lungs work closely together, chronic lung disease like COPD can significantly impact cardiac function, making cardiac complications the most common and clinically significant concern. Shifting our attention now to question number 35, we look at an important aspect of newborn care. A first-time parent asks the nurse for guidance on caring for their newborn's umbilical cord stump. Which instruction should the nurse emphasize during teaching? The options are 1. A moderate amount of drainage is normal and expected. 2. Keep the umbilical area moist using sterile normal saline. 3. Give sponge baths until the cord stump naturally falls off. 4. Apply a sterile dressing over the cord twice daily. The correct answer is option 3. Give sponge baths until the cord stump naturally falls off. This teaching point is critical for preventing infection and promoting proper healing. Until the stump naturally detaches, usually within 1 to 3 weeks after birth, parents should avoid soaking the area in water. Sponge baths help keep the area clean and dry, minimizing the risk of bacterial growth or delayed cord separation due to moisture retention. This simple but essential measure supports safe cord care and reduces the risk of complications like omphalitis. Let us now turn to question number 36, which focuses on respiratory care following a surgical procedure. The question states, a client recovering from a lower lobe lung resection is experiencing increased respiratory secretions. Which independent nursing intervention is most appropriate in this situation? The options include 1. Perform postural drainage, 2. Reposition the client frequently, 3. Administer a prescribed expectorant, 4. Apply chest percussion and vibration. The correct answer is option 2. Reposition the client frequently. This is an essential and fully independent nursing action that does not require a prescription. By changing the client's position at regular intervals, the nurse helps enhance lung expansion, mobilize mucus from dependent areas of the lungs, and support better oxygenation. Frequent repositioning also aids in preventing complications such as atelectasis and pneumonia, making it a simple but highly effective intervention in post-operative pulmonary care. Let us continue with question number 37, which addresses therapeutic communication in the context of client anxiety about a major surgical procedure. The scenario is as follows. A client with invasive bladder cancer is scheduled for a cystectomy with an ileal conduit. After the healthcare provider explains the procedure, the client voices concern about potential unpleasant odors following surgery. What is the most therapeutic response by the nurse? The options are, can you share more about what concerns you the most? 2. There are products available to manage odor if it becomes a problem. 3. Odor can be an issue, but the surgery is necessary to treat your condition. 4. Many people who undergo this procedure have the same concern. The correct answer is option 1. Can you share more about what concerns you the most? This open-ended question is a cornerstone of therapeutic communication because it creates space for the client to express specific fears or misconceptions in their own words. Rather than jumping to solutions or offering reassurance too quickly, the nurse first seeks to understand the client's emotional perspective. This helps build trust and allows the nurse to tailor future education and support to the client's individual needs. Moving on to question number 38, this one focuses on developmental psychology, specifically Jean Piaget's theory of cognitive development. The question asks, according to Jean Piaget's theory of cognitive development, which milestone should the nurse expect to observe in a 6-month-old infant? The options provided are 1. Early development of memory skills, 2. Awareness of time-related concepts, 3. Continued display of reflexive behaviors, 4. Initial signs of object permanence. The correct answer is option 4. Initial signs of object permanence. At around 6 months of age, infants begin to demonstrate early understanding that an object still exists even when it is no longer visible. This milestone marks a transition within the sensory-motor stage of Piaget's theory and indicates growing cognitive awareness and curiosity. It reflects the infant's evolving brain development and increasing interaction with their environment, laying the groundwork for more complex thinking in later stages. Let us now proceed to question number 39, which focuses on maternal positioning during labor with internal fetal monitoring. The scenario is as follows. A nurse is caring for a laboring client with an internal fetal monitor in place. What guidance should the nurse provide regarding maternal positioning during monitoring? The available options are: 1. The client may choose any position that feels most comfortable. 2. Internal monitoring is most accurate in the side-lying position. 3. The leads can be removed. The client may choose any position that feels most comfortable. Internal fetal monitoring involves a spiral electrode attached directly to the fetal scalp, which provides continuous and accurate readings regardless of the mother's position. Because positioning does not impact the effectiveness of internal monitoring, it is safe and appropriate for the laboring client to choose positions that offer the most comfort, mobility, or pain relief. Encouraging freedom of movement can also promote labor progression and improve maternal satisfaction. Let us now explore question number 40, which highlights the recognition of respiratory distress in a newborn. The question states, during a newborn assessment, the nurse observes a clinical sign that suggests respiratory distress. Which finding most clearly indicates this condition? The options include Seizure, nasal flaring, elevated heart rate 3, abdominal breathing 4, slowed respiratory rate. The correct answer is option 1, nasal flaring. This is one of the most obvious and early signs of respiratory distress in newborns. When a newborn is having difficulty breathing, the nostrils widen with each inhalation in an effort to draw in more air. This compensatory mechanism helps increase oxygen intake and is considered a significant marker of compromised respiratory function. In fact, nasal flaring is part of the Silverman-Anderson Index, a clinical tool used to assess the severity of respiratory distress in neonates. Quick reminder, if you are serious about passing the NCLEX, do not miss our complete NCLEX course. Now at 70% off for a limited time. You will get live classes, 100 hours of animated crash course content, 500 hours of recorded lectures, 5,000 past NCLEX questions, 15 full-length mock tests, and in-depth breakdowns of 500 next-gen questions. Plus, it includes an exclusive NCLEX ebook, PDF notes, study planners, and 1-year full access. The link is in the description. Enroll today and take the next step toward becoming a licensed nurse. Next, let us look at question number 41, which discusses breast changes in the early postpartum period. The scenario goes, on the 3rd day after giving birth, a breastfeeding client calls the clinic complaining that her breasts feel swollen and tight. Before responding, what physiological factor should the nurse consider as the most likely cause of this engorgement? The options are 1. Excessive milk production, 2. Ineffective breastfeeding technique, 3. Lack of proper breast support, 4. Congestion of the breast's lymphatic and venous systems. The correct answer is option 4, congestion of the breast's lymphatic and venous systems. In the early days following delivery, engorgement is most often due to the normal physiological changes that prepare the body for breastfeeding. Around the 3rd day postpartum, the hormone prolactin stimulates the breast tissue, leading to increased blood flow and lymphatic congestion even before full milk production has begun. This vascular and lymphatic fullness causes the breast to feel tight, swollen, and uncomfortable. It is a common and temporary phase in lactation and is not always a result of overproduction or poor technique. Let us now move on to question number 42, which focuses on emergency first aid care for a burn injury. The question reads, while at the beach, an individual sustains a deep partial thickness burn due to severe sun exposure. What is the most appropriate first aid measure the nurse should recommend before the person seeks medical attention? The options are A. Apply cool, moist towels. B. Cover the area with dry, sterile dressings. C. Use an over-the-counter sunburn relief spray. D. Apply vitamin A and D ointment to the burn. The correct answer is option A. Apply cool, moist towels. This is the most effective immediate intervention to reduce residual heat in the tissue, relieve discomfort, and minimize further skin damage. Cool compresses help lower the skin temperature, decrease inflammation, and provide temporary pain relief without introducing harmful chemicals or agents that might irritate sensitive burned skin. It is a simple, safe, and appropriate action while awaiting further evaluation. Now turning to question number 43, This one focuses on newborn assessment and identifying abnormal findings that require further attention. The question is, a nurse is performing a routine assessment on a full-term newborn. Which finding requires further evaluation and follow-up? The options include A. Presence of a positive Babinski reflex. B. Head circumference measuring 33 centimeters. C. Hip abduction limited to 30 degrees. D. Umbilical cord with 3 vessels. The correct answer is option C. Hip abduction limited to 30 degrees. This finding is not considered normal and may suggest developmental dysplasia of the hip, a condition where the hip joint is not properly formed. Limited abduction can be an early sign and, if left untreated, may lead to mobility problems, joint instability, or gait abnormalities. Early identification and referral for ultrasound or orthopedic evaluation are key to preventing long-term complications. Let us continue with question number 44, which examines the impact of normal aging on various physiological and psychological functions. The question asks, while assessing a group of older adult clients, the nurse considers the effects of normal aging. Which function is least likely to be significantly impacted by the aging process? The options are A. Sense of taste or smell. B. Gastrointestinal motility. C. Muscle strength and motor function. D. Coping mechanisms for stress. The correct answer is option D. Coping mechanisms for stress. While physical changes such as diminished taste and smell, slower gastrointestinal motility, and reduced muscle strength are common with aging, the ability to cope with stress typically remains intact. Most older adults retain their lifelong coping styles and emotional resilience unless there is underlying cognitive impairment or severe mental health conditions. Therefore, psychological adaptation and stress management are generally preserved and are the least affected among the listed options. Now, let us move to question number 45, which addresses immediate newborn care following delivery. The scenario states, immediately after delivery, a preterm newborn is assessed and receives an Apgar score of 6. What should be the nurse's first action? The options are A. Clamp and inspect the umbilical cord. B. Dry the infant and place the infant in a warm environment. C. Take a footprint and apply an identification band. D. Gather resuscitation supplies and assist the healthcare provider. The correct answer is option B. Dry the infant and place the infant in a warm environment. An Apgar score of 6 indicates moderate depression and signals the need for prompt supportive interventions. The nurse's first priority is to support thermoregulation and stimulate breathing. Drying the newborn helps reduce evaporative heat loss, and providing a warm environment, such as using a radiant warmer or skin-to-skin contact, ensures the infant maintains body temperature. This action also promotes more effective oxygenation, which is especially important for preterm infants with immature thermoregulatory systems. Let us have a look on question number 46, which highlights postoperative care for a client who has just undergone a transurethral resection of the prostate, commonly known as a TURP. The question asks, when caring for a client who has just undergone a transurethral resection of the prostate, which nursing action is the highest priority? The options are A. Maintain the patency of the cystostomy tube. B. Ensure the indwelling urinary catheter remains patent. C. Keep the abdominal surgical dressing clean and dry. D. Monitor for signs of hemorrhage and wound infection. The correct answer is option B. Ensure the indwelling urinary catheter remains patent. Following a TURP, continuous bladder irrigation is typically initiated to flush out blood clots and maintain clear urine output. The catheter's patency is absolutely critical, as any obstruction can lead to bladder distension, increased pressure on the surgical site, and even hemorrhage. By keeping the catheter flowing freely, the nurse helps reduce the risk of these serious complications and promotes proper healing of the resected tissue. Let us now proceed to question number 47, which focuses on therapeutic communication in psychiatric nursing. The scenario is as follows. A client on a psychiatric unit who experiences auditory hallucinations is prescribed a neuroleptic medication for the first time. When given the pill and a cup of water, the client holds them and stares without responding. What is the most therapeutic statement the nurse can make? The options are A. You need to take your medication now. B. Your doctor wants you to have this medication. Please swallow it. C. It seems like you do not want to take your medicine. Why is that? D. This medicine was ordered to help you get better. The correct answer is option B. Your doctor wants you to have this medication. Please swallow it. This statement provides clear direction while maintaining a calm, non-confrontational tone. It gently reinforces the importance of taking the medication without forcing or challenging the client, which is especially important when hallucinations may be interfering with perception or decision-making. By clearly communicating expectations and supporting the client's autonomy, the nurse encourages compliance in a therapeutic and respectful way. Let us now explore question number 48, which centers on using therapeutic communication to support emotional expression in a mental health setting. The scenario is, following a counseling session, a client at the mental health clinic approaches the nurse and states that the therapist seemed impersonal and uncaring. Which response by the nurse would be the most therapeutic? The options are A. Your therapist is actually very skilled. B. Hopefully the rest of us on staff have been more caring. C. The therapist is trying to help you, so it is important to cooperate. D. It sounds like you have strong feelings about your therapist and the session. The correct answer is option D. It sounds like you have strong feelings about your therapist and the session. This response uses a reflective communication technique that helps the client feel heard and encourages them to elaborate on their emotions. Rather than dismissing the client's concerns or defending the therapist, the nurse remains non-judgmental and supportive. This approach fosters trust, promotes emotional insight, and keeps the therapeutic dialogue open, an essential strategy in mental health nursing. Now moving on to question number 49. This one emphasizes critical post-operative monitoring following an organ transplant. The question reads, a client who has just received a kidney transplant is transferred from the post-anesthesia care unit to the intensive care unit. How frequently should the nurse monitor this client's urinary output? The options are A. Every hour, B. Every 2 hours, C. Every 30 minutes, D. Every 15 minutes. The correct answer is option A. Every hour. After a kidney transplant, close monitoring of urinary output is vital because it provides real-time feedback on the function of the newly transplanted kidney. Hourly assessments allow the nurse to detect early signs of graft rejection, reduced kidney perfusion, or urinary tract obstruction. A sudden decrease or absence of urine can indicate serious complications, and prompt intervention is necessary to preserve graft function and stabilize the client's condition. Let us now examine question number 50, which addresses behavioral observations in a psychiatric setting. The question is, a client engages in ritualistic behavior and is observed tapping other clients on the shoulder 3 times as part of the ritual. Based on this behavior, what should the nurse infer about the client's condition? The choices are A. The client has a blurred sense of personal identity. B. The client struggles with controlling sudden impulses. C. The client shows impaired awareness of personal space. D. The client is exhibiting a reduced ability to cope with stress. The correct answer is option D. The client is exhibiting a reduced ability to cope with stress. This type of repetitive, ritualistic behavior is often a sign that the individual is attempting to manage severe internal anxiety or distress. Rather than being simply impulsive or unaware, the client is using rituals as a rigid coping mechanism to gain a sense of control. Although the behavior may appear unusual, it reflects a deeper psychological attempt to relieve overwhelming emotional pressure in a maladaptive way. Quick reminder, if you are serious about passing the NCLEX, do not miss our complete NCLEX course. Now at 70% off for a limited time, you will get live classes, 100 hours of animated crash course content, 500 hours of recorded lectures, 5,000 past NCLEX questions, 15 full-length mock tests, and in-depth breakdowns of 500 next-gen questions. Plus, it includes an exclusive NCLEX ebook, PDF notes, study planners, and 1-year full access. The link is in the description. Enroll today and take the next step toward becoming a licensed nurse. Let us now turn to question number 51, which focuses on medication safety during high-risk obstetric care. The scenario is, a pregnant client with severe preeclampsia is receiving intravenous magnesium sulfate. Which item should the nurse ensure is readily available at the bedside in case of magnesium sulfate toxicity? The options are A. Oxygen, B. Naloxone, C. Calcium gluconate, D. Suction equipment. The correct answer is option C. Calcium gluconate. This medication serves as the specific antidote for magnesium sulfate toxicity. If the client develops signs such as respiratory depression, absent deep tendon reflexes, or cardiac dysrhythmias due to magnesium overdose, calcium gluconate is administered to rapidly counteract these effects. For safety, it is essential that the nurse keeps this antidote at the bedside whenever magnesium sulfate is being infused, particularly in clients with preeclampsia, who are at high risk for toxicity due to renal impairment and the drug's narrow therapeutic range. Let us now move forward to question number 52, which addresses nutritional management in a young child newly diagnosed with cystic fibrosis. The scenario reads, the parent of a 2-year-old recently diagnosed with cystic fibrosis expresses concern about the child's low weight and frail appearance. What is the most appropriate response by the nurse? The options are A. Your child will be prescribed digestive enzymes to help break down and absorb nutrients. B. Once respiratory therapy begins, your child's appetite should increase. C. Coughing and breathing difficulties make it hard for your child to chew and eat enough. D. You should try offering baby food, as it is easier for your child to digest. The correct answer is option A. Your child will be prescribed digestive enzymes to help break down and absorb nutrients. In cystic fibrosis, the thick mucus secretions can obstruct the pancreatic ducts, preventing natural digestive enzymes from reaching the intestines. This results in malabsorption of nutrients, leading to poor growth, weight loss, and a frail appearance. Administering oral pancreatic enzymes with meals is essential to improve digestion and promote healthy weight gain. This explanation offers both reassurance and education, making it the most therapeutic and informative response. Now, let us turn to question number 53, which focuses on early detection of potential complications during an infant's first well baby visit. The scenario is, at the infant's first well baby checkup after hospital discharge, the parents report that their newborn has trouble sucking and swallowing and becomes easily fatigued during feedings. What should the nurse consider as the most likely concern during the assessment? The options are A. Fatigue during feeding is normal for many newborns. B. Difficulty sucking is not concerning if the baby is not cyanotic. C. Feeding difficulties may be an early sign of a congenital heart defect. D. Retained mucus from birth may still be interfering with feeding. The correct answer is option C. Feeding difficulties may be an early sign of a congenital heart defect. In newborns, feeding is a high-energy activity that requires coordinated sucking, swallowing, and breathing. When the cardiovascular system is compromised, as in many congenital heart defects, the infant may not be able to maintain adequate oxygenation and cardiac output during feeding. This leads to early fatigue, poor intake, and even failure to thrive. Identifying these subtle signs early is critical, as they often precede more obvious symptoms like cyanosis or respiratory distress. Let us now proceed to question number 54, which highlights the physical manifestations of chronic oxygen deprivation in pediatric clients. The question reads, which clinical sign should the nurse closely monitor in a child diagnosed with chronic hypoxia? The options are A. Clubbing of the fingers, B. Slow and irregular breathing patterns, C. Presence of subcutaneous bleeding, D. Reduced red blood cell levels. The correct answer is option A. Clubbing of the fingers. In children with chronic hypoxia, the body attempts to adapt by promoting new capillary growth and soft tissue expansion at the fingertips, resulting in a bulbous or rounded appearance known as digital clubbing. This physical change is a classic long-term indicator of poor oxygenation and is often associated with congenital heart disease or chronic pulmonary conditions. Monitoring for this sign can help the nurse assess the ongoing severity and progression of hypoxia in affected children. Let us move on to question number 55, which focuses on immediate postoperative care following orthopedic surgery. The scenario reads, a client has just undergone a total hip arthroplasty. Which nursing intervention is most appropriate in the immediate postoperative period? The options are A. Position a pillow between the legs to maintain abduction. B. Elevate the affected leg on a pillow to reduce swelling. C. Use the log rolling technique to reposition the client. D. Apply a trochanter roll along the length of the leg. The correct answer is option A. Position a pillow between the legs to maintain abduction. After a total hip replacement, maintaining proper hip alignment is critical to prevent dislocation of the prosthetic joint. By placing a pillow between the legs, the nurse helps keep the hip in an abducted position, which reduces strain on the surgical site and supports the integrity of the new joint. This positioning is especially important during turning or repositioning in bed during the early recovery phase. Let us now address question number 56, which focuses on prioritizing care in a psychiatric setting. The question is, which of the following clients on a psychiatric unit requires the nurse's immediate therapeutic intervention? The options are A. A 51-year-old woman pacing in the day room and initiating conflicts with other clients. B. A 28-year-old man mimicking a machine gun in front of the nurse's station. C. A 49-year-old man sitting silently in the corner, observing others. D. A 38-year-old woman wandering aimlessly and saying, "I just do not know what to do. I feel so lost." The correct answer is option A. A 51-year-old woman pacing in the day room and initiating conflicts with other clients. This client is exhibiting behaviors that indicate increasing agitation and potential aggression, which poses an immediate threat to the safety of both the client and others in the environment. Early and therapeutic intervention is critical to de-escalate the situation, reduce tension, and prevent harm. In psychiatric nursing, addressing behaviors that jeopardize safety is always the highest priority. Let us now review question number 57, which focuses on the rationale behind a common respiratory intervention in pediatric care. The scenario reads, the parents of a child diagnosed with the spasmodic croup ask why the nurse is administering humidified oxygen. What is the primary therapeutic purpose of this treatment? The options are A. It helps reduce swelling in the airway tissues. B. It serves as a method to deliver inhaled medications. C. It increases surface tension in the respiratory passages. D. It creates an environment that is free from germs. The correct answer is option A. It helps reduce swelling in the airway tissues. In spasmodic croup, inflammation and edema of the larynx and upper airway can lead to stridor and difficulty breathing. Administering cool, humidified oxygen helps to moisten and soothe the irritated mucosa, which in turn reduces swelling and improves airway patency. This simple yet effective measure supports easier breathing and greater comfort for the child during an acute episode. Let us now turn to question number 58, which focuses on individualized care planning for a child with autism. The question asks, when developing a care plan for a child with autism, the nurse considers preferred activities. Which play activity is most likely to be enjoyable for this child? The options are A. Climbing on a jungle gym. B. Playing with a soft, cuddly stuffed animal. C. Manipulating a small yellow block. D. Spinning on a playground merry-go-round. The correct answer is option D. Spinning on a playground merry-go-round. Children with autism spectrum disorder often gravitate toward repetitive, rhythmic, and sensory-based play that provides soothing input to their nervous system. Spinning offers vestibular stimulation, which can help with sensory integration, spatial orientation, and emotional regulation. Activities like this are frequently calming and enjoyable for children with autism, making them highly preferred during unstructured or therapeutic playtime. 59. Now let us proceed to question number 59, which focuses on prenatal assessment and the early detection of pregnancy complications. The scenario states, a client who is 26 weeks pregnant arrives for a routine prenatal visit. Her blood pressure is 150/86, and she reports gaining 5 pounds over the past 2 weeks. What should be the nurse's priority action? The options are A. Check the client's urine for protein. B. Measure the client's body temperature. C. Prepare the client for a vaginal examination. D. Schedule a follow-up visit in 1 week. The correct answer is option A. Check the client's urine for protein. This client is showing 2 early warning signs of possible preeclampsia, elevated blood pressure, and sudden weight gain. The next priority action is to assess for proteinuria, which, if present, would further support the diagnosis of preeclampsia. Prompt identification is essential to prevent complications such as eclampsia, preterm labor, or fetal growth restriction. Urine testing provides a quick and critical data point in evaluating maternal and fetal risk. Finally, let us review question number 60, which addresses electrolyte monitoring in clients with chronic kidney failure. The question reads, a client is admitted with a diagnosis of chronic kidney failure. Which electrolyte imbalance should the nurse closely monitor for in this client? The options are A. Low potassium levels, hypokalemia. B. Low calcium levels, hypocalcemia. C. High sodium levels, hypernatremia. D. High blood glucose levels, hyperglycemia. The correct answer is option B. low calcium levels, hypocalcemia. In chronic kidney failure, the kidneys lose their ability to effectively excrete phosphorus. As phosphorus accumulates in the bloodstream, it binds to calcium, leading to decreased serum calcium levels. This disruption in calcium-phosphorus balance is a hallmark complication of renal failure and can lead to symptoms such as muscle cramps, bone pain, and even cardiac arrhythmias if not managed. Therefore, hypocalcemia is a critical electrolyte imbalance the nurse must monitor closely in these clients. Quick reminder, if you are serious about passing the NCLEX, do not miss our complete NCLEX course. Now at 70% off for a limited time. You will get live classes, 100 hours of animated crash course content, 500 hours of recorded lectures, 5,000 past NCLEX questions, 15 full-length mock tests, and in-depth breakdowns of 500 next-gen questions. Plus, it includes an exclusive NCLEX ebook, PDF notes, study planners, and 1-year full access. The link is in the description. Enroll today and take the next step toward becoming a licensed nurse. Let us now take a closer look at question number 61, which focuses on evaluating laboratory results during a routine prenatal visit. The scenario reads, a woman in her 6th month of pregnancy visits the prenatal clinic for the first time. As part of the initial evaluation, a complete blood count and urinalysis are obtained. Which laboratory findings should prompt the nurse to conduct further assessment? The options are A. White blood cell count of 9,000 per cubic millimeter. B. Hemoglobin level of 10 grams per deciliter. C. Urine-specific gravity of 1.020. D. Glucose level of 1+ in the urine. The correct answer is option B, hemoglobin level of 10 grams per deciliter. While a slight decrease in hemoglobin is expected during pregnancy due to normal hemodilution, levels below 11 grams per deciliter in the 2nd trimester are considered abnormally low and indicate anemia. Anemia during pregnancy increases the risk of maternal fatigue, poor fetal growth, and complications during delivery. Further assessment and nutritional or medical intervention are needed to correct this deficiency and support both maternal and fetal health. Let us now address question number 62, which focuses on postpartum assessment. The scenario states, 2 hours after a normal labor and delivery, a nurse assesses a client and finds the uterine fundus positioned 4 finger breadths above the umbilicus. The client is catheterized, but the uterus remains firm and at the same elevated level. What is the nurse's priority action? The options are A. Reassess the client's vital signs. B. Plan to recatheterize the client in 1 hour. C. Immediately notify the healthcare provider. D. Continue to palpate the fundus every 2 hours. The correct answer is option C. Immediately notify the healthcare provider. A uterine fundus that is significantly elevated above the umbilicus despite being firm and after ensuring the bladder is emptied may indicate concealed hemorrhage or retained placental fragments. This is not a normal postpartum finding and requires prompt medical evaluation to prevent rapid deterioration. Now moving to question number 63, which focuses on postoperative assessment following orthopedic surgery. The question reads, a nurse is caring for a client who has undergone open reduction and internal fixation for a fractured hip. Which assessment of the affected extremity is most important in the immediate postoperative period? The options are 1. Assessing the femoral pulse. 2. Checking toe movement and mobility. 3. Inspecting the pin site for signs of infection. 4. Evaluating knee range of motion. The correct answer is option 2. Checking toe movement and mobility. This assessment is essential for evaluating motor function and neurovascular integrity distal to the surgical site. Any impairment in toe movement could be an early sign of nerve compression or compartment syndrome, both of which require immediate attention to preserve limb function and prevent long-term damage. Let us now move to question number 64, which highlights a critical aspect of pediatric respiratory assessment. The scenario is, a nurse is caring for a child diagnosed with spasmodic croup. Which clinical finding should alert the nurse that immediate intervention is necessary? The options are irritability. 2. Hoarseness. 3. Barking cough. 4. Rapid respirations. The correct answer is option 4, rapid respirations. In a child with croup, an increased respiratory rate is an early and urgent warning sign of potential airway obstruction. It indicates that the child is struggling to maintain adequate ventilation due to narrowing of the upper airway. Rapid breathing typically comes before more severe indicators, such as stridor at rest, chest retractions, or cyanosis. Prompt recognition and intervention are essential to prevent respiratory failure and ensure the child maintains a patent airway. Now, let us move on to the next important question regarding pediatric discharge education. The scenario 65 is, when preparing a child with persistent asthma for discharge, what is the most important teaching point the nurse must emphasize to the family? The options are, a cold, dry environment is desirable. The child should not be restricted by any behavioral limits. The asthma is cured once symptoms subside. Asthma medications must be continued even when the child is symptom-free. The correct answer is option 4. Asthma medications must be continued even when the child is symptom-free. This is a key teaching point in asthma management. Persistent asthma requires daily maintenance with controller medications, such as inhaled corticosteroids or leukotriene modifiers, to reduce chronic airway inflammation and prevent sudden exacerbations. Even if the child is feeling fine, stopping these medications can lead to poorly controlled symptoms and increased risk of hospitalization. Let us now keep an attention onto question number 66, which addresses the care of an older adult with dementia during their transition into a long-term care facility. The scenario is, a newly admitted older adult with dementia is showing signs of confusion, agitation, and frequently does not recognize others around them. What is the most appropriate initial nursing intervention to support the client's adjustment to the long-term care facility? The options are A. Begin a structured program of therapeutic social activities. B. Provide detailed explanations about the facility's routines. C. Encourage the client to express feelings about the admission. D. Ensure consistent staff presence to offer reassurance and supervision. The correct answer is option D, ensure consistent staff presence to offer reassurance and supervision. At the beginning of a new admission, especially for clients with dementia, consistency and familiarity are key to minimizing distress. Having the same staff members provide care helps reduce confusion, enhance trust, and provide emotional comfort. This steady presence allows the client to feel more secure in an unfamiliar setting, supports safer behavior management, and facilitates smoother adjustment to the new environment. Let us now continue with question number 67, which focuses on the diagnostic evaluation of a child with symptoms suggestive of meningitis. The scenario is, the parents of a child who is experiencing fever, headache, and a stiff neck are concerned that the child may have meningitis. Which diagnostic test should the nurse explain is used to confirm the presence of meningitis? The options are 1. Myelogram, 2. Blood culture 3. Lumbar puncture 4. Peripheral skin smear. The correct answer is option 3, lumbar puncture. A lumbar puncture, also known as a spinal tap, is the gold standard for diagnosing meningitis. It allows for direct analysis of cerebrospinal fluid to detect infection, identify the causative organism, and determine the presence of white blood cells, protein, and glucose levels. While blood cultures may also be helpful, the lumbar puncture provides the most definitive evidence for central nervous system infection and is essential for initiating targeted antimicrobial therapy. Let us now move forward to question number 68, which addresses a critical aspect of post-operative monitoring after lung surgery. The scenario reads, a nurse is caring for a client who has just undergone a left pneumonectomy for lung cancer. During post-operative assessment, the nurse routinely palpates the client's trachea. What is the primary rationale for this nursing intervention? The options are 1. To detect a possible mediastinal shift. To identify nodular lesions indicating metastasis. 3. To assess for tracheal edema causing airway obstruction. 4. To check for overinflation of the endotracheal tube cuff. The correct answer is option 1. To detect a possible mediastinal shift. Following a pneumonectomy, especially when an entire lung is removed, pressure imbalances in the thoracic cavity can cause the mediastinum to shift toward the surgical side or away from it. Depending on fluid buildup or tension changes, palpating the trachea for deviation from the midline is a simple but essential bedside assessment that helps the nurse recognize serious complications such as tension pneumothorax or significant fluid accumulation. Early detection through tracheal palpation supports prompt medical intervention and improves post-operative outcomes. Let us now look at question number 69, which focuses on providing a therapeutic and informative response to a client's concern about preoperative testing. The scenario is a complete blood count, urinalysis, and chest X-ray are ordered for a client scheduled for surgery. When the client asks why these tests are necessary, which is the most appropriate nursing response? The options are 1. Do not worry, these tests are just routine. 2. These tests help identify any underlying health risks. 3. The results determine if surgery can be performed safely. 4. I'm not sure. Your healthcare provider ordered them. The correct answer is option 2. These tests help identify any underlying health risks. This response is clear, accurate, and therapeutic. It respects the client's right to understand their care and provides a brief but meaningful explanation. Preoperative tests such as a complete blood count, urinalysis, and chest X-ray are used to detect issues like infection, anemia, or pulmonary complications that could affect surgical outcomes. Educating the client in this way builds trust, supports informed consent, and encourages active participation in care decisions. Let us now review question number 70, which focuses on preoperative nursing priorities in an emergency setting. The question is, a client is scheduled for emergency abdominal surgery. Which preoperative nursing objective takes priority in the immediate period before surgery? The options are A. Documenting accurate baseline vital signs. B. Reducing the client's anxiety. C. Educating the client about the importance of early ambulation. D. Supporting the client's nutritional needs. The correct answer is option B. Reducing the client's anxiety. In emergency surgical situations, addressing the client's emotional well-being is crucial. High levels of anxiety can negatively impact the client's understanding of instructions, increase the physiological stress response, and raise the risk of post-operative complications. By helping to calm the client, the nurse creates a safer and more cooperative environment for further assessments, teaching, and procedural preparation. Quick reminder, if you are serious about passing the NCLEX, do not miss our complete NCLEX course. Now at 70% off for a limited time, you will get live classes, 100 hours of animated crash course content, 500 hours of recorded lectures, 5,000 past NCLEX questions, 15 full-length mock tests, and in-depth breakdowns of 500 next-gen questions. Plus, it includes an exclusive NCLEX ebook, PDF notes, study planners, and 1-year full access. The link is in the description. Enroll today and take the next step toward becoming a licensed nurse. Let us now move to question number 71, which highlights critical discharge teaching for an infant with a newly placed ventriculoperitoneal (VP) shunt. The question asks, which complication should the nurse emphasize to the parents as the most important to watch for after discharge? An infant diagnosed with hydrocephalus is being prepared for discharge following the surgical placement of a VP shunt. The options are A. Sudden onset of violent involuntary muscle contractions. B. Persistent upward gaze with visible sclera above the irises. C. Noticeable fluid accumulation in the abdomen. D. Fever accompanied by decreased responsiveness. The correct answer is option D, fever accompanied by decreased responsiveness. This symptom combination is highly concerning for shunt infection or central nervous system infection, both of which are serious and potentially life-threatening complications of VP shunt placement. Because infants cannot verbalize their discomfort, it is vital that parents are taught to recognize subtle changes such as lethargy, irritability, poor feeding, or fever, and seek immediate medical evaluation if these occur. Early detection and treatment of shunt infection can prevent severe neurologic damage and other complications. Let us now focus on question number 72, which involves providing clear and accurate education to the parents of a child with recurrent leukemia. The question reads, parents of a child with recurrent leukemia are considering a bone marrow transplant and ask the nurse to explain the procedure. What is the most accurate and appropriate response? The options are A. Bone marrow transplants are rarely done in children. B. The child's immune system must be destroyed before the transplant can take place. C. The stem cells are surgically implanted directly into the bone marrow. D. The procedure is simple and requires little preparation since the stem cells are infused like a blood transfusion. The correct answer is option B. The child's immune system must be destroyed before the transplant can take place. Before a bone marrow transplant can occur, the child must undergo a preparatory process called conditioning, which involves high-dose chemotherapy and sometimes total body irradiation. This step is essential to eliminate the child's existing bone marrow and to suppress the immune system. reducing the risk of transplant rejection and making space for the new stem cells to engraft. This explanation provides the most medically accurate and informative response, helping the parents understand the complexity and seriousness of the procedure. Let us now look at question number 73, which emphasizes emotional support and role development in postpartum care. The question asks, while caring for a new mother on the postpartum unit, what is the most important nursing action to support the development of her parenting role? The options are A. Teach the mother how to care for her newborn. B. Allow uninterrupted time for mother and infant bonding. C. Answer the mother's questions about her infant's behavior. D. Demonstrate newborn care and assess the mother's return demonstration. The correct answer is option B. Allow uninterrupted time for mother and infant bonding. In the early postpartum period, the most crucial aspect of supporting the new mother's transition into her parenting role is encouraging bonding. Allowing uninterrupted time for skin-to-skin contact, eye contact, and quiet interaction strengthens the emotional connection, promotes confidence, and helps the mother respond more intuitively to her infant's cues. While education and demonstration are valuable, they should follow the establishment of this emotional foundation, which nurtures trust, attachment, and the instinctive development of maternal behaviors. Take a moment to question number 74, which focuses on medication education for a client-prescribed famotidine. The question is, a healthcare provider prescribes famotidine, Pepcid, for a client diagnosed with dyspepsia. When providing medication teaching, what is the most important information for the nurse to include about this drug? The options are A. It helps reduce the client's stress level. B. It neutralizes excess stomach acid. C. It slows down gastrointestinal peristalsis. D. It decreases acid secretions in the stomach. The correct answer is option D. It decreases acid secretions in the stomach. Famotidine is an H2 receptor antagonist that works by blocking histamine at H2 receptors on the gastric parietal cells, leading to reduced secretion of stomach acid. This makes it particularly effective for treating dyspepsia, gastroesophageal reflux, and peptic ulcers by lowering acidity and promoting healing of the gastric lining. Educating the client about this mechanism helps reinforce the importance of medication adherence for symptom relief and mucosal protection. Let us now examine question number 75, which focuses on the recognition and management of a potentially life-threatening transfusion reaction. The scenario reads, a client begins to exhibit fever, chills, and low back pain shortly after receiving a blood transfusion following emergency surgery. What is the nurse's priority action? The options are A. Notify the healthcare provider immediately. Stop the transfusion and begin infusing normal saline. C. Request a prescription for an antihistamine. D. Slow the transfusion rate and notify the blood bank. The correct answer is option B. Stop the transfusion and begin infusing normal saline. These symptoms, fever, chills, and low back pain, strongly indicate an acute hemolytic transfusion reaction, which is a medical emergency. The first and most critical action is to stop the transfusion immediately to prevent further destruction of red blood cells. The nurse should then begin a normal saline infusion with new tubing to maintain intravenous access and support renal perfusion. Prompt intervention helps prevent complications such as acute kidney injury, shock, and disseminated intravascular coagulation. Thanks for joining today's NCLEX test series. Keep practicing daily to build your confidence and clinical judgment. Follow our channel for more test series and expert NCLEX tips. See you in the next session.